the scourge of opiate addiction that everyone in this room and in the state certainly knows about. And today we had the privilege of attending the bill signing by Governor Baker of H4056, an act relative to substance use, treatment, education, and prevention. And we're all going to speak a little bit, but I'll turn it over to Senator Fatman first. Before that, I just want to thank Harrington for hosting us here. You can see firsthand the work that they're doing. So with that, Senator Fatman will talk a little bit about the bill, and we'll move through the program here.
Thank you much, Representative. I'm going to be brief because I am not feeling well. This is probably appropriate that I'm at the emergency room. But I do want to just try to put things into perspective very briefly. Back in 2008, when you looked at deaths based on overdoses due to heroin or opioids, there was about 8.6 per 100,000 people in the Commonwealth. This past year, that spiked to 17.6, almost doubling. And you know, it just puts things in perspective of what a major problem this is and how we have taken a step in the right direction by Governor Baker signing this opioid legislation into law today. And it shows you the power and effectiveness of what people who are elected can do when they work in a bicameral, bipartisan way. For me, you know, the real crux of the problem has been empowering patients and looking at individuals and families and how they might be able to solve this crisis. And two things that I wanted to look at and just talk a little bit about that are provided in this bill are the ability of an individual who comes across their first prescription for opioids only to get a 7-day prescription for that amount, which is a really effective part of this process, because what we found is that many young people who have gotten addicted to opioids and then have seen it travel to other things like heroin start with a sports injury, and they get a prescription filled with 60 pills, and it makes no sense for that injury. The second thing I wanted to point out is that we empower patients to be able to say no, that if they don't feel comfortable with a specific prescription, that they can say they want a reduced prescription, and that's a huge aspect of this legislation. And lastly, what I'd like to concentrate on before I turn it over to Representative Quiros is the screening in schools for targeted populations, because when I was in high school, even in middle school, this wasn't really a large issue. You always heard about some people doing drugs, but this has become a much broader problem. And today, kids who are very young because of sports injuries or whatever are getting into this. Well, this allows for schools to do screenings, and it also empowers families that if they don't feel comfortable with that, to opt out. I think those are two components of this are large steps in the right direction. And I know we've been talking about this just as recently in Uxbridge the other night at an opioid forum that we had. And I'm going to invite Representative Quiros to speak a little bit about that and fill in other parts of the bill that he finds are appropriate. Kevin?
Thank you, Senator. When I was elected to the legislature 5 years ago to represent 4 fairly small towns, Uxbridge, Blackstone, Millville, and Bellingham, never would I have thought that opioid addiction would have been such an issue in my 4 communities. And the reality of it is, it's everywhere right now. Just as years ago, many years ago, we used to not talk about cancer. It was kind of like the hush-hush, the quiet conversations. And then people started talking more about cancer, and money poured into it, and research improved, and treatment improved, and cancer no longer became viewed as a death sentence like it used to be. And if I were to ask the people here today to raise their hands if they either are a cancer survivor or are related to one, probably every hand would go up. And we've changed the conversation about cancer. Part of Governor Baker's objective in the opioid battle is also to change the stigmatization of the disease. And his commission recently issued their report declaring that it is a public health crisis and not just a public safety or criminal crisis. And more law enforcement professionals are treating it as the health crisis that it is. Senator Fatman mentioned a community forum that we co-hosted just last week in Uxbridge. And we brought together a panel of experts from treatment, but also from law enforcement, from the EMT department. Our fire chief was there, our school superintendent was there, and also some people who are struggling with addiction. And they tell you the stories, and you learn that it really does hit home for so many people. Just a few quick stats: 4 people a day in the Commonwealth die from heroin overdoses. Okay? And 4 out of 5 heroin users had their first exposure to opiates from a physician's prescription. So we need to think about these components, as we move forward in fighting the scourge. The bill that the governor signed today is very aggressive. He, when he filed it, recognized he was pushing the envelope on some things, actually asking for some things that he knew he'd never get. But if you don't get aggressive in treating these types of epidemics, you don't get the results that you need. We can't incrementally change ourselves or incrementally improve things to combat that. And I think what the governor, through his leadership, did was got the most comprehensive anti-opioid bill in the United States passed today. And I was proud and pleased to stand with him as he signed the bill today. So I will actually turn the podium over to Representative Paul Frost to share his comments. But thank you so much for coming out and supporting this battle against the scourge.
Thank you, Representative Kuros, and thank you to my rest of my colleagues that are here, Senator Fatman, Representative Durant, Representative Meridian, and Representative McKenna. So just want to thank you all for allowing us to do this, and thank the hospital for having us and hosting us. Apologize, I'm a few minutes late here. Had a meeting just prior to this, and of course, didn't want to break the law, but got behind a school bus coming down Route 12. I made the mistake of not jumping onto 395, so I obeyed the law and did not pass the school bus every time it stopped every 10 feet. But I do want to say, want to commend the governor and the lieutenant governor for their tremendous effort in pushing this bill forward. They made this part of their agenda when they first took office just a little over a year ago. And here we are today. The governor got to sign a bill into law. And it's an issue that we all know is dear and dear to a lot of people's hearts. If you don't know somebody personally, I guarantee you know somebody who, a family or a friend or a coworker who has suffered the loss of a loved one due to an overdose death. And we have to do something about it, and we are. And as I know, as my colleagues have already mentioned, it's a long fight. There's more to be done. There's more that will be done. And it's an effort that we're going to have to work with our communities on, our first responders. We're going to have to work in our schools. We're going to have to work, with our civic groups and religious groups and others to get the word out. Because one of the biggest things we need to do, and it's easier said than done, and the bill tries to tackle that, is how do we get people from getting addicted in the first place, especially when most of them, or many of them, have started going down this dark road based on prescription medications, pain medications given to them. So it's not like they woke up one day and said, I want to try heroin. And I'm sure there's some folks who did get introduced to it at a party or something else. But we can do something about the prescription drugs, and we're going to tackle it. We know it's going to be tough. We know there's a lot of people out there who do need the prescription medications, who do need the pain medications. They need that help, and we can't deny them that. So it's going to be a tough line to do this so that we can treat people the proper way, but keep them from getting addicted and keeping them from leaving around extra pills around the house so that little Johnny or little Sally, can get them, or their friends come over the house and they go into the medicine cabinet in the bathroom and then they have access to these pills that lead down worse, a very, very dark road. We have a lot to do. We have a lot of challenges. I think this is the first big step, though, in the right direction, and I look forward to working with my colleagues, with the governor, lieutenant governor, with our area hospitals, and again, first responders and local communities and schools to really tackle and address this issue And I want to thank you very, very much for having this. And again, thanks for the local media, by the way, that came out. Thank you. Because it's through you that we're going to emphasize what happened today with this bill signing. It's through you that brings it down. Listen, I got 2 communities, Oxford and Millbury, that according to Channel 5 are in the top 50 communities across the state that have had deaths due to overdose. Okay? So I know that's touching the people in my district. I know it's touching the people here in Webster and elsewhere in southern Worcester County and throughout Central Mass and throughout our state. So it's important. And I want to thank you very, very much for the local media for covering this and helping us get the word out there that this is a problem. We need to tackle the problem, and together we will do it over time. So thank you very, very much.
Thank you, Ben. I'll be brief. These my colleagues have touched on a lot of the issues that that are part of this crisis. I just want to say that this is an issue that touches all of us, and I think as Representative Frost said, if it hasn't touched you personally, then you know somebody who's it's touched, and somebody who's been involved, and somebody who's been addicted. Just seeing these families and seeing the heartache that they have to go through in order to get their children help, in order to break this addiction. Is so tough, and it's so financially difficult on them, and they have to go through so much to do so. I want to just touch on what Harrington's doing here, and I think Ed's going to come up and maybe speak about it as well, but this bill is really about a community partnership, and it's about making sure that we have the tools necessary in order to get the job done. It's a good first step. There's going to be a long way to go, but here at Harrington, where we're adding locked beds and a facility to help deal with these addictions and help people get the help, get the services that they need, is so important. It's one thing to pass a bill. It's one thing to try to change things and make effect through the legislative process. But once it gets implemented down on the local level, this is where the rubber meets the road, right here. And that's why we came here today to Harrington Hospital to highlight this is the place where legislation meets action. And I want to thank Harrington for all the work that they've done and for the foresight to see this and to see what's coming down the road and to help that out. I think one of my colleagues had mentioned, we're talking 4 people a day in Massachusetts that die from this. And that's just an astonishing number. It's every day. And when we get to the holiday periods, that number goes up. That number goes up when stress of holidays comes and things of that nature. So this is so important to these communities. Representative Frost talked about having communities in the top 50. And I remember just thinking about this. I remember, when this crisis started really ramping up, thinking to myself, heroin. Huh, people still do heroin, huh? That's kind of odd. But, sometimes you don't see what's going on right in front of you. And to watch this kind of ramp up has really been astonishing. So, again, I want to thank the Baker administration and thank my colleagues. I'm happy that we were able to get this done, moving in the right direction. And again, I want to thank Ed Moore and Harrington Hospital for really helping implement a lot of the pieces of this legislation. I'm going to turn it over to my colleague, Representative Murity. Thank you.
Thank you, Peter. Thank you, everyone, for coming. I guess we saved the best for last. I will be brief as well, because a lot of my colleagues have touched on a lot of the main points of this bill. And one thing that I want to talk about is actually the prescription monitoring program, which is a part of it. And I will actually tell a personal story about it. And I'm a proud graduate of Worcester State, just down the road. And in college, my roommate actually had a bit of a cyst in the back of his neck. And we went to the hospital, and it ended up just being something that had to be drained. And when it was drained, he was given a full bottle, 30 pills of Vicodin. And maybe he needed one to get through the evening. Then he was given a refill as well. So that's 60 pills that potentially could have been out there. Now, not everyone was as law-abiding as myself and my roommate, as we only used what he needed and then threw him out. And I flushed him, but that's a whole other issue, sorry. But we got rid of him. But that's a big issue, is the prescription monitoring program. It's something that I'm happy that the Baker-Polito administration fought hard to get into the bill. Happy that the Senate and the House kept in their versions of the bill. And I want to say I'm very proud of the fact that it was unanimously supported by both Republicans and Democrats in the House and the Senate. It shows that, we realize that there's an epidemic. We realize that for every step that you take to get into the woods, it probably takes 2 to get out. So this is the first step in curbing this epidemic, and I think it was Kevin who said earlier that it's a public health crisis now. You know, and this is, even being there today, it was quite moving to hear some of the testimony and the stories. And you realize that this affects everyone. You know, addiction doesn't discriminate whether you're rich or poor, whether you're black or white. It does not discriminate, man or woman. You know, so it's something that we all have to take an active role in, becoming more educated, becoming more responsible with, and I'm happy to be here with my colleagues for that. I want to thank Harrington Hospital, and I want to thank Representative McKenna for taking the lead and setting this up. He's a great advocate for Harrington. We should be really lucky to have him here, so thank you.
And I just wanted to kind of wrap it up a little bit. We had talked a little bit about sending a press release out to everyone, and we came to the decision that this issue was far too important to simply send out a press release. We wanted to come together to talk to you, and it's not always where, as legislators, we can look back at the end of a day and say we did something good today. But today is really one of those days where I'm very, very proud to have accomplished something really substantive. But we tend to take too much credit as legislators for things that you are all doing. And so it's no surprise that the people who are in this room, very much by design, because this is a community problem, and it's the community that's going to come together to solve the next steps. And we're here in Webster, but if we held this meeting in Blackstone or Upton, Northbridge, Millbury, we would have a room just like this filled with stakeholders. So I just want to point out a few people. We've got Pastor Janice Ford, who's doing some incredible advocacy and work with her parish, the Episcopal Church. We've got Webster EMS, Ted Avalos from the school department. We've got Leslie and Terry from the Webster Adult Ed, the schools as well. We've got the Worcester County Sheriff's Office represented here, Byron with the Resource Center in town. All stakeholders in town, this is such a community thing, and it's the community that's going to build on this very first step that the legislature has taken in order to really solve the problem ultimately. And finally, but perhaps most importantly, is Harrington again. And I want to introduce Greg. I can never say your last name, so I'm not going to try, but he is the Vice President for Addiction and Recovery Services here at Harrington. And I just want to invite him up to talk a little bit about some of the programs that Peter had introduced. You see the gem that they've created here in Webster. Harrington came in and really did an incredible job making sure that this resource for the community stayed and is going to continue to grow. So I think that'll wrap it up for the legislatures. Again, we want to just thank you all for coming out, and I'll turn it over to Greg for a couple comments on behalf of Harrington.